But here's what makes this phenomenon truly terrifying. Medical researchers have found that villages using high levels of pesticides in Punjab have significantly higher cancer rates than villages using fewer chemicals. Tonight, we explore the cancer train, the Green Revolution's hidden cost. Beginning in the 1960s, scientists, led by Dr. Norman Borlaug, introduced the Green Revolution, a transformation combining high-yield seeds, chemical fertilizers, and pesticides to dramatically increase agricultural output. Punjab and Haryana became the primary laboratories for this agricultural experiment. The results were extraordinary. Agricultural productivity skyrocketed from inadequate subsistence to surplus. India transformed from a food-importing nation desperate for foreign grain into an exporter generating foreign currency. Millions of Indians were fed who would otherwise have starved. By any intensive chemical treatment. Farmers here use at least 15 different pesticide sprays throughout a growing season, many classified by the U.S. Environmental Protection Agency as possible, likely probable, or known human carcinogens. Among pesticides widely used on Punjab's cotton were acephate, diron, pendimethyline, chemicals linked to cancer, neurological damage, and reproductive harm in epidemiological studies. Additionally, hexachloroquiclocan, HCH, DDT, endosulfan, and chlorpyrifos persisted in soil and groundwater long after application, contaminating agricultural ecosystems for decades. What made the situation catastrophic was how farmers applied these poisons. Most lacked protective equipment. They mixed chemicals without masks, gloves, or respirators, inhaling toxic fumes directly. They stored pesticide drums in sheds attached to homes where families slept. Children played in fields sprayed the previous day. Farmers bathed in wells drawing from groundwater contaminated by decades of pesticide seepage. The groundwater, the primary drinking water source across rural Punjab, became systematically poisoned. What began as agricultural enhancement transformed into slow, widespread poisoning of an entire population. By the 2000s, an alarming, undeniable pattern emerged. Cancer rates in high pesticide areas of Malwa were astronomically higher than expected or typical for rural agricultural regions. Dr. Ayesh Kumar from the prestigious Postgraduate Institute of Medical Education and Research PGIMER in Chundiar conducted what would become a landmark epidemiological study examining decades of medical data, analyzing comprehensive data from 1993 to 2003, and reviewing medical records from thousands of farming families. His research team found a statistically significant increase in cancer rates in high pesticide villages compared to low pesticide villages. The affected districts included Bathinda, Faridkot, Moga, Muktaz, Farizepur, Sanger, and Mansik, collectively known as the Malwa region. These areas reported cancer rates far exceeding national averages. In Faridkot Medical College, oncologist Dr. Manjeet S. Jora reported receiving an extraordinary 30 to 35 new cancer cases daily in a single facility in a region of just a few million people. This caseload was unprecedented for rural India. Environmental activists used the powerful image hundreds of cancer patients crammed into a train every night, repeating night after night, year after year, as devastating visual evidence of agricultural chemical poisoning on a massive scale. On any given evening, the platform at Bathinda station would fill with cancer patients. Many so ill they could barely walk independently. Families accompanied patients, carrying meager belongings, medical files, and documents required for hospital admission. Some patients were in wheelchairs or stretchers. The train departed at 9:30 p.m. and arrived in Bikaner around 6 a.m. after a grueling 325-kilometer overnight journey. According to Parliament records and railway documentation, approximately 100 cancer patients traveled nightly on this train, translating to roughly 36,500 patients annually and over hundreds of thousands over the 2 decades since the phenomenon became noticeable. Activists documented the phenomenon extensively. Photographs showed patients lying on train seats, their exhausted families sitting vigil. News reports chronicled stories of farmers, their children, their grandparents, entire families affected by cancer. The cancer train became a symbol not of medical progress, but of an agricultural system gone terribly wrong. However, over time, the cancer train narrative has become increasingly contested by agricultural industry groups. Agricultural chemical corporations and farm industry associations argue the story is a myth built on isolated incidents and amplified by environmental activism to demonize pesticide use. The Crop Care Federation of India, CCFI, representing agricultural chemical manufacturers, published detailed counter-analysis challenging the cancer crisis narrative. They argue that Punjab ranks in the lower tier of cancer incidence among Indian states, not the highest. As cancer train advocates suggest, the Federation claims that portraying Punjab as a cancer capital through the cancer train narrative is not only statistically inaccurate, but also deeply insults the hardworking farmers of Punjab who feed the nation. They further argue that cancer increases could result from multiple overlapping factors. Improved health awareness, modern diagnosis reveals cancers previously undiscovered. Tobacco use, dietary changes associated with increased prosperity and consumption of processed foods. Industrial pollution from factories alongside agricultural areas, and demographic aging, older populations naturally show higher cancer rates. The reality is that causation in epidemiology is extraordinarily complex and difficult to prove definitively. Dr. Rajesh Kumar himself cautioned that his study, while showing correlation between high pesticide use and higher cancer rates, does not definitively prove that pesticides were the sole culprit. It could be industrial pollution, he noted carefully. Or perhaps as farmers improved their standard of living, they began smoking more tobacco and changed to less healthful diets. Or it could be a combination of all those factors simultaneously: pesticides, tobacco, diet, and industrial pollution together, creating the cancer spike. versus other factors. Share your thoughts in the comments below. This exploration of the cancer train where the Green Revolution shadow continues claiming lives decades later disturbed you. Hit like, subscribe to Silent Conspiracy, and ring the bell.